Next up, we have our BSN program. The BSN program, again, usually takes about 4 years to complete and includes core classes like music, English, and writing, and all those types of courses along with the nursing courses. There's also a lot more nursing theory and specialized nursing courses like community and gerontology and evidence-based practice in the BSN curriculum. After graduation, BSN prepared nurses are able to do the same things that the associate's degree nurses are able to do. They're going to sit for their NCLEX. They're going to provide that safe, evidence-based, patient-centered care. They're going to work in the same types of facilities like hospitals or outpatient or long-term care facilities. They're going to administer medications. They're going to manage all those IV lines. They're going to be observing patients' conditions and be able to put all of that theory that they've learned into practice. The BSN prepared nurses are also more likely to be able to give direction and supervision to nurses' aides and home health aides as well. So a little bit more of an authority type figure. The pay grade is also a little bit higher for the BSN prepared nurse because they do have more theory that they can apply as opposed to the associate degree nurses. The general concerns with Shadow Health for them are the inexperienced students that may lead to frustration with knowing how to interview our patients. So basically, they're going to be taking the health assessment course, and they're going to have a lot of theory, but not a ton of practice interviewing live patients. So there can be a little bit of a disconnect there. What I would do is I would discuss emphasizing the interview guide for some of the assignments and then perhaps turning it off at some point to test the students' learning. So go ahead and allow them to use the interview guide during the health history or maybe the first couple of assignments and kind of get them in the rhythm and really teach them how to really some best practices with the interview and how to really execute a nice interview and physical assessment, and then go ahead and turn that interview guide off and really test their learning. I would also emphasize that this is a learning tool that can be used to help students practice or gain confidence in their assessment skills. Practice in that virtual environment, and then take that confidence that they've gained in the virtual environment and move it right into their clinical practice with their patients in their clinical settings. So some really nice ways that Shadow Health can enhance the curriculum for the BSN students as well. So here are the commonly required courses. We have all kinds of different areas that we could fit into. The gold standards here, we have the health history could really be used in the human development and health promotion across the lifespan. So Tina has a lot of room for improvement in the area of education and health promotion. So they could really use her and the education portion, teaching her about her diabetes and her asthma and her high blood pressure and really how nutritionally how to take care of herself. So that could really be utilized in that type of a course. We also have the health assessment, which of course our health assessment product fits nicely with. The concept labs can be used in the anatomy and physiology, again, to allow students to become familiar with the anatomy and the associated sounds. They also have an acute illness or an adult health and illness course. I would suggest using the health history and the focus exams if they have not done so already in the health assessment. There is a gerontology class, which our gerontology fits obviously very nicely into. Same with the mental health. There is a specific course for mental health nursing in a BSN program, and our mental health patients fit nicely in there. There is a women and children's class, so we can use Danny for, and then again that pharmacology class where the students are going to learn, med calculations and how to safely and effectively, understand medication. So our pharmacology program can fit nicely in there as well. The community health, I had suggested here that Nicole Diaz from our mental health product could fit nicely in there. It could be a fit if it is because this is an outpatient visit. Students could practice looking for outpatient resources in their own communities for Nicole and kind of help her along the way to be a safer and happier and healthier patient out there in the community with all the resources. So you could really extend that or any of our patients into that. So if you could have them pretend that they were discharging Tina Jones and then go through a teaching plan and look for community resources that way as well. But I did select Nicole Diaz here because it is in fact an outpatient visit. That is the BSN overview.